Next we have Jill Edwards. She's the Senior Program Manager at the T. Colin Campbell Center for Nutrition Studies. She received her BA in Education from the University of Michigan and MS in Exercise Science from Oakland University. She's a certified clinical exercise specialist through the American College for Sports Medicine and is the Senior Program Manager for the Plant-Based Nutrition Certificate. Jill has attended Dr. Caldwell Esselstyn's Heart Disease Reversal Program at the Cleveland Clinic and has over 8 years of experience helping patients recover in Cardiopulmonary Rehab. Here to share that we don't have to be helpless victims of heart disease or diabetes, our next speaker, Jill Edwards.
Well, good morning, everybody. Nice to see everybody. So my lecture will tag on to what Dr. Lord was saying about heart disease. Heart disease and type 2 diabetes are very much connected. Quick statistics as well. Just like she said, almost 10% of us have diabetes. 1 in 3 of us have prediabetes, which means with the current trends, 1 in 3 of us will develop full-blown diabetes within the next decade. We're going to talk about type 2 today, but I wanted to define the difference. Type 1 is caused by destruction of the insulin-producing beta cells of the pancreas, which leads to complete insulin deficiency. But this only accounts for about 5 to 10% of all diabetes cases. Type 2 is different. It generally, people have enough insulin, but the cells become resistant to it, and it leads to too much glucose in the bloodstream, where it can cause problems. So it's the combination of insulin resistance and this pancreatic cellular failure that leads to type 2 diabetes. This is oftentimes due to lifestyle. So the old approach to treating type 2 diabetes was throwing medication at it, such as metformin or glucophage, and giving dietary suggestions like reducing portion sizes, consuming less or lean animal protein, and limiting carbohydrates, so a low-carb diet. So has this approach worked? When we look at the trends from early 2000s to now, we see that diabetes has skyrocketed. Even though we're throwing medication at it, we're giving these low-carb recommendations. So no, it's not working. The interesting thing is that our sugar consumption is falling. So diabetes is rising, but our sugar consumption in this country is actually falling. We're drinking less soda pop because we're consuming more bottled water, bottled teas, different types of sugar-free beverages. So if the current method isn't working, what does work? So do we need to possibly talk about a different dietary change, different drugs? And again, just like Chippy was saying with heart disease, we can prevent it and reverse it. Same thing, same type of diet is for diabetes as well. They go hand in hand. A couple of research studies we're going to go over. A study from the New England Journal of Medicine took thousands of pre-diabetics and diabetics. They were put into 2 groups. One was the drug group, where they either got a drug, metformin, or they got a placebo. And the other group was a lifestyle group. So they were prescribed exercise and diet. Half those folks were put on a low-carb diet, high-fat, high-protein. The other ones were put on a whole foods, plant-based diet. So a diet that's focused on whole grains, legumes, fruits, and vegetables. A note about the metformin drug, it is considered one of the safest diabetes drugs out there, but it still causes diarrhea in half, makes 1 in 4 nauseous, 1 in 10 suffer from physical weakness, and 1 in 67,000 are killed by this drug every year. When I used to work in cardiac rehab at Esselstyn Memorial Hospital, many of our patients were also type 2 diabetics, and they would oftentimes have these complaints of the side effects of the drug. However, the drug works. When we compare it to a sugar pill placebo, it does work. Fewer people in that drug group got diabetes. However, following a low-fat plant-based diet and exercise worked better, significantly better. The plant-based eaters with exercise reduced diabetes by 100%. No one in that group developed diabetes, compared to only 31% of that metformin group. So, which would you prefer, the diarrhea or some broccoli? So, again, we could treat these diseases and throw money in it, again, just like Dr. Lori was saying, or we can actually get at the root cause of it and see what the focus is, diet and exercise. Most of the research done on the mechanism of how diet helps type 2 diabetes is done on insulin resistance. This is a really recent study done this year, but it actually tested plant food in relationship to beta cell function in the pancreas. So 16 weeks, the intervention group was given a low-fat, plant-based diet focused again on fruits, vegetables, beans, legumes, whole grains, so think bean burrito instead of chicken burrito, and they had no calorie limits whatsoever. The control group made no dietary changes. What they found, the plant-based eaters improved the function of their beta cells in the pancreas. And that's really important because the beta cells produce insulin. And it's the loss of this beta cell function that can lead to type 2 diabetes. So really important finding on the mechanism of how food can turn type 2 diabetes around. The Adventist Health Study took almost 90,000 people. And what they did is they looked at the diabetes prevalence and then the types of diets those folks were eating. And what was so cool is that they actually saw a drop in type 2 diabetes as one moved further away from eating animal protein. So as we move from eating meat to less meat to just fish to eggs and dairy to no animal protein at all, we saw a protection built in there the further that we got to a whole foods plant-based diet. So what could be the problem? Could it be the fat in the animal foods, the meat, the eggs, the dairy, or vegetable oils that interfere with insulin's ability to move glucose in the cell? And we know through research that yes, indeed that is an issue. So if you think of a cell and it's full of fat, okay, the insulin acting like a key can't get in there to do its job to open the lock to allow glucose to get in there to do its work. So fat is an issue. Tagging on what Dr. Naluri said, 1 serving of processed meat per day increases your risk of diabetes by 51%. That's a piece of bacon at breakfast. That's some lunch meat at lunch or some sausage. So really significant. The World Health Organization actually has classified processed meat as a carcinogen. So it's in the same category as cigarettes. So what if we ate a healthy diet that had a little bit of meat, right? And meat I define as anything with a mother, a face, okay? So meat meaning fish, chicken, poultry, beef, etc. Or is it better to eat none at all? And we didn't really have a lot of research on this until recently. So looking to another population, so traditionally Asian populations have had really low rates of diabetes. So, but in recent decades, there has been an epidemic that's emerged. It definitely coincides with increased animal food consumption, but our Western ways have also traveled east, and they are eating a lot more junk food, a lot more fast food. When my husband and I were over in China a few years ago, we were appalled by all the KFCs that were around in every single corner. There was a study done by National University, and they didn't want to just compare the vegetarians to the typical meat eaters. What they wanted to look at was population that were eating no junk food, no processed food whatsoever. So they compared Buddhist vegans to Buddhist non-vegetarians eating very traditional Asian diets. What they found is that even the non-vegetarians were eating really a ton of plants. The women were only eating about a serving of animal food per week, so maybe an egg a week, or maybe a small piece of fish or chicken a week. Men were eating about a serving of animal food every few days. Both groups were eating healthy. No soda pop, no fast food, no processed food in either group. So which group fared better? So, despite the similarities, and they controlled for weight, family history, exercise, and smoking, the men eating vegan or 100% plant-based had just half the rates of diabetes, and the women just a fourth of the rates. So a big difference by just taking away that little bit of animal protein per week or every few days. So again, even in a population that's eating a lot of plants, it made such a big difference when we took away that animal protein. So again, we see that through the research that the closer that we get to a whole foods plant-based diet, the better overall for type 2 diabetes. The weight control study done by PCRM, Physicians Committee for Responsible Medicine, took 64 women. They were moderately to severely overweight, postmenopausal, and pre-diabetic or diabetic. The intervention group consumed a low-fat plant-based diet, but they weren't prescribed any exercise. They wanted to take a look at just diet for this one. The control group was prescribed what's called a therapeutic lifestyle diet. That is defined by lean meats, low-fat dairy, eggs, veggies, low grains, and a low amount of fruit. They were also prescribed no exercise. The typical meal of the plant-based group was very carb-heavy is how we would think of it. So something that generally, as the old approach to diabetes, would never have been prescribed. So whole grain pancakes, oatmeal with cinnamon and raisins, cantaloupe, rye toast with jam, chunky vegetable chili, garden salad, a banana, lentil soup, whole grain pasta with marinara sauce and some vegetables. So this is the typical day meal for the intervention group. So after 14 weeks, that group lost more weight, 13 pounds on average. They lost 2 inches from their waist. But what's so cool is they were able to sustain their weight loss for 2 years. Anyone can lose weight on any type of diet that either restricts calories. I could lose weight just by smoking cigarettes. I can lose weight by getting cancer. I can lose weight by just eating bacon every day. But that doesn't always translate to long-term positive health outcomes. And that's where this is really important. HbA1c is a measure of blood sugar over a period of time. And so that gives us a really good indication in tracking the disease, if it's managing, if it's reversing, if it is progressing. So both groups, okay, got better on their HbA1c. We want that lower towards 6. But what was interesting is that over time, the people eating that low-carb group tended to then creep back up. So it wasn't sustainable. The folks eating the whole food plant-based diet, their HbA1c got better and better and better. And then eventually, most of those folks were off of their diabetes medication if they were on them. So again, when you look at the common denominator of the research, it's really changed in the last decade. It's completely, what we've known about diabetes has been turned on its head. Consistently, we see that whole foods, plant-based, they're the ones that prevent, manage, and even more importantly, reverse the disease. So this new understanding of nutritional causes of diabetes, it really gives us the power. A, to keep it from occurring, just like Chippy was saying, prevention is key, and to turn it around though once we have it. So the new dietary approach, focus on whole grains, beans, legumes, fruits, and vegetables. Some of our lunch choices today are going to be representative of this. We have a portobello wrap and some hummuses and different salads. There's so many success stories out there. This is one I just wanted to share. Eric O'Bray, he lost more than 100 pounds and reversed type 2 diabetes after transitioning to a low-fat, plant-based diet within a year. He lowered his cholesterol by 160 points. No statin does that. He restored his blood pressure. No amount of beta blocker or lisinopril or ACE inhibitor can do that. And he reduces glucose levels. But most importantly, he went off all medications that most type 2 diabetics are told they're going to be on the rest of their lives. There's so many programs out there that actually promote and help to teach this way of eating and lifestyle. So I only had 20 minutes, so I didn't get as far into the exercise and the stress, but those are also very important components of type 2 diabetes. But you have Kaiser Permanente, mostly based on the West Coast, that deals with plant-based diets and how to reverse chronic disease, especially heart disease and diabetes. The Bernard Medical Center has a diabetes reversal program in Washington, D.C. Cleveland Clinic's wellness program works with heart patients as well as type 2 diabetics to reverse their disease. And the Dougal program out of California. What's so great is we have the Ornish program here in Florida, right here in Sarasota. But the only unfortunate thing about the Ornish program is you have to have a heart attack, a stent, open heart surgery, or a valve repair or replacement to qualify for it. So right now, that's all Medicare will cover for it, but we're hoping over time, and there's big lobbying going on right now for Medicare to allow it to be more of a preventative program. But right now, you have to be sick to get into it. There is an online diabetes summit called Mastering Diabetes, and I put the slide on here because everyone does have access to the slides online. That way you can see some of the doctors around the country that are actually working with lifestyle, with food and exercise to actually reverse this disease. I wanted to end with this quote, one of my favorites by Dr. Dean Ornish. Think about it, heart disease and diabetes, which account for more deaths in the US and worldwide than everything else combined, are completely preventable by making comprehensive lifestyle changes without drugs and without surgery. So my proposal to you is if you know anyone who's diabetic or with heart disease, again, which are risk factors for each other, advise them to give 3 weeks to focusing just on whole plant food. You know, they have nothing to lose, but maybe their diabetes and getting off medication. Thank you, everybody.
Well, I don't know if y'all noticed how active that presentation was. I don't know how many calories were burned during that, but this was a very active thing, kind of walking the talk. It makes me wonder if, you know, back in the biblical days of Genesis, if the Creator didn't say, don't eat the animals, and Adam and Eve said they thought that it was apples.